News. It's the lead story. Oh, it must have been, I think it was an Associated Press story. It was about a month ago. And Fauci had said that in order to get to herd immunity, we're going to have to get to, I think he said at the time, 80 to 90% people vaccinated. And the only way mathematically we could do that is you were going to have to start to vaccinate school children. Now, we put that up. Nobody else covered it. It was a buried lead. We went nuts on it, and they haven't mentioned it since then. They've talked about now trying to get because at the time you hadn't even done any testing, right, of the vaccine on school children. Why, and am I missing it? Because I know you follow this from a scientific point of view. Why are they not including, or at least putting forward every day when they talk about herd immunity, part of the calculation being the population that, because it would seem to me that if you add who's been infected, coupled with, I think they say 40% of the American people have one jab, 25% have two jabs. If you add that, aren't we mathematically at herd immunity right now?
Yes, we are as an average across the country, but you have some states that had very little herd immunity to start with, and now the vaccinations have gotten them to the peak or just past the peak of the epidemic curve, and so it'll take them quite a while to come down. The vaccination, because it only cuts transmission by 50 to 60% and not by 90%, it's not that strong to shut off the infection. So yes, it is adding to herd immunity, but it's not enough to bring it down fast. And that's the reason why Dr. Fauci is still espousing distancing and mask wearing and so on, because he's trying to say we need more than just the 50 to 60% benefit in order to bring the infections down more quickly. And so you have the states, that have too little herd immunity from before that need more vaccination, and the states that have lots of herd immunity, like I said, North Dakota, South Dakota, Tennessee, and so on, that don't need the vaccinations because they already have a large amount of herd immunity. Their case numbers are small.